My name is Zoe Clark. I'm Self-Management Programme Officer for NASS, and today I'm delighted to be joined by Dom Urmston, who is Patient Advocacy and Communications Manager for the Psoriasis Association. Hi Dom, thank you for joining us today.
Hi Zoe, pleasure to be here. Looking forward to it.
Brilliant. How are you today?
Yeah, I'm good. I'm good. You know, all ready to go. Always pleased to be talking about psoriasis, raising awareness.
Brilliant. Yeah, we're really pleased to have you with us today because I know that we get a lot of questions from people with axial SpA about their skin, about psoriasis and the link that there is there. So I think it'll be a really popular session, and based on the comments we've had on the ads so far and the questions we've had ahead of time, I think it'll be a really useful session for everyone as well. So thanks for giving us your time and your expertise today.
Yeah, my pleasure. My pleasure. Looking forward to it. Hopefully it'll be informative. Try and get as much as I can.
Brilliant, thank you. So yeah, we, as I said, we've had some questions through beforehand, but to anyone watching, please do pop your questions in the comments because we'll go through all of them at the end, so we'll make sure that we cover everything. And if you are joining us live, say hello in the comments. It'd be great to see who's joining us, and I'll keep an eye on them as we go through as well. And it's always a good chance to chat with other people with AS and AxSpA as well. So do share your experiences if you're comfortable doing that. Share if you've got psoriasis and any things that help you as well, because I think it can be really helpful to get advice from each other too. Brilliant. So I think we should be all ready to go. I think I'll just check if we've got any questions and comments coming in already and make sure that we're good to go. We've got Raj joining us. Hi Raj, thanks for joining. Wonderful. So yeah, we'll get started, and hi to Michelle as well, and Natalie watching too. So firstly, a good place to start, Dom, I'll let you introduce yourself and the Psoriasis Association first of all.
Thanks Zoe. So hi everyone, I'm Dom Urmston. I'm Patient Advocacy and Communications Manager at the Psoriasis Association, and we're the leading national charity membership organisation for people with psoriasis and psoriatic arthritis in the UK. So I've personally been with the association for just coming up to 6.5 years now, and day to day my role involves managing our digital output, so mostly the website and our social media channels, and also looking for any issues that are raised by people with psoriasis and psoriatic arthritis. Anything from treatment availability to gaps in our information or issues with care, and then trying to work on those to improve them for people.
Brilliant. And I know you do loads of work, so for everyone watching, we've signposted to your website and your social media page in the video description, so do head there for all the information and links to your helpline and so on. It's a treasure trove of info.
Yeah, that would be great.
Brilliant. So I suppose the first place to start would be if you want to just explain to us what psoriasis is and how it can affect people.
Sure. So psoriasis is an immune condition which causes symptoms on the skin and sometimes the joints too. It's quite a common condition. The estimate is between 2 to 3% of the population. So a good analogy is if you're on a double-decker bus, it's likely that somebody on there has psoriasis. It can affect, it's equally as common in men and women. It can affect people of all ethnicities and ages. However, there are two peaks that have been noticed of onset around about the ages of 20 to 30 and then 50 to 60. The root cause of psoriasis still isn't known at this moment in time. However, we do know that the changes cause psoriasis to appear begin in the immune system. So there are cells called T cells, which are triggered to become overactive, and they act as if they're fighting an infection or healing a wound, and in doing so release inflammatory chemicals. This inflammation then causes the overproduction of skin cells, which is what leads to the plaques of skin forming, which are the most common symptoms of psoriasis. There are a number of types of psoriasis, so it's not just one condition, there are different types. The most common by far is plaque psoriasis. The symptoms are kind of as I just described, so it's flaky sort of plaques of skin which are raised, and they're often red underneath on fairer skin or darker on darker skin types. So that's the most common type of you also see plaque psoriasis commonly on the scalp. On the scalp, it can be very thick, so kind of thick scale, and it can cause flaky bits of skin to fall. It can be red around the hairline, and it can be difficult to manage on the scalp. You can imagine kind of part of the hair to treat psoriasis is there. So going on to the next type, so there's also a type called guttate psoriasis. Guttate psoriasis involves smaller plaques of psoriasis. So rather than the larger plaques you see in plaque psoriasis, it's almost like pox size. They tend to be pink or red and widespread on the torso, back, and limbs. Guttate psoriasis is more common in younger people, so teenagers, young adults, although it can affect people of all ages. And it is it can go away of its own accord, so lasts a period of weeks or months, but it can be prone to flare up again, and in some cases can go on to evolve into different type of psoriasis. We also have pustular psoriasis. This is an umbrella term for two types of psoriasis, which are distinct from one another. One is palmoplantar pustulosis, which is a bit of a mouthful. We call it PPP. This affects the palms of the hands and soles of the feet specifically, and it's involved pustules, so kind of pus-filled spots, which form on the hands and feet. And you can imagine this can be really uncomfortable, and in severe cases quite debilitating, because we use our hands and feet so much in day-to-day life. And then there's generalized pustular psoriasis, or GPP, and that's the similar symptoms, the pustules on top of red or darkened skin. This is more widespread across the body. And GPP in more severe cases can be quite serious. The skin can become hot to the touch, and it struggles to regulate the body temperature. And in those cases, generalized pustular psoriasis will need hospital treatment. Nail psoriasis too, so it's all in the name, affects the nails, can be fingernails or toenails, and that's most common symptoms are pitting of the nails, thickening, the nails can crack, crumble, and also they can detach from the nail bed, which can be really uncomfortable if you catch a psoriatic nail. And nail psoriasis is also a very common symptom of psoriatic arthritis, which is inflammatory arthritis, which is common in people with psoriasis. Thought to affect around 1 in 5 people with psoriasis. Not everybody who gets psoriasis will go on to get psoriatic arthritis. And you can have psoriatic arthritis without having psoriasis on the skin. The most common signs and symptoms of psoriatic arthritis are swollen, tender joints, particularly in the hands and feet, although that can affect other joints too. Nail psoriasis, general tiredness, fatigue as well. I think there's one more type I haven't talked about yet, which is psoriasis in sensitive areas. So sensitive areas we're referring to really places like the armpit, skin folds, and also the genitals. Psoriasis in these areas can be red and shiny, so it's not quite as flaky as in other areas, but if you can imagine how skin rubbing on skin, it can be really irritable. The face is another sensitive area, although psoriasis on the face tends to appear more flaky and less red. So it's slightly different in appearance from psoriasis. The armpits, the skin. That's a roundup of the main types for you.
Brilliant. That was a really good overview. And interestingly, I didn't realise that you can a sort of common peak of when psoriasis can start is in sort of 50s and 60s as well. So I've already learned something new today. Thank you. Yeah, I hadn't realised that. Certainly, one thing you sort of touched on there was psoriatic arthritis, and it's probably good for me to say to everyone watching, if you have some kind of inflammatory arthritis or symptoms, then we'd recommend speaking to a rheumatologist who would be able to look at all the different symptoms you have and do the right test. Because I know with Axial SpA being in a similar group of conditions, the rheumatologists are the specialists that would be able to decipher between them. One thing you mentioned as well was looking at was the fact that the symptoms can flare up. So I don't know if you come across any like common flares for psoriasis that people tend to find.
So different things can psoriasis, it's very difficult to pin down, but there's no general rules that apply to everybody, as with a lot of conditions. There are some common triggers that have been identified. So one is stress, which is, unhelpful, particularly in the times we're living in, stressful times. It can be difficult to avoid stress at the best of times. However, a lot of people have noticed that their psoriasis does flare up or can appear the first time during a stressful situation. So yes, stress is a key common trigger. Injury to the skin is another one. So this is referred to as the Koebner phenomenon, after the person who first described this patient. And this can be psoriasis forming at the sites of a wound or surgical scar, but it can also form on sites of more minor skin trauma, so things even just like injections, piercing sites. Again, it's not the same for everybody, but that's another relatively common trigger for psoriasis. Certain medications have been linked to triggering psoriasis. I'm not going to go into that in too much detail now because I don't want to leave any out. It's probably better to visit our website and read more about that. As with all these triggers, not the case for everybody. And hormones too. So psoriasis has been observed to flare up more around time of puberty and menopause for women, and also during pregnancy. Pregnancy is really interesting, actually. It can go one of two ways. Some women have reported that their psoriasis symptoms have actually cleared up almost altogether during pregnancy. However, on the flip side of that, other women have experienced the complete opposite and they're flared during pregnancy, which is a tricky time as well if your psoriasis becomes more severe in pregnancy, because you don't always have the same range of treatment options available to you at that time. So that's interesting. We're still not quite sure why that happens or why it's so different for different people. And then there's also lifestyle triggers. Lifestyle is an interesting topic, and we still don't fully understand lifestyle connection with triggering psoriasis just yet. Anecdotally, we've heard that some people feel that particularly changing their diet or specific foods they feel trigger their psoriasis, but at this moment in time, there's not the evidence to point to any specific food types. We do know that smoking and alcohol have been known to exacerbate symptoms of psoriasis. So if you already have psoriasis and you smoke or drink to excess, then it can make the symptoms worse or make certain treatments less likely to work.
That's really helpful at sort of looking at the different triggers that commonly can sort of cause a flare-up of psoriasis. And interestingly, there's some real similarities there with axial SpA in general as well. And certainly smoking, we always say if you're able to avoid it, please do, because certainly with axial SpA and AS, that can really aggravate the symptoms and also the progression of the condition as well. So yeah, it's all similar things. So I suppose that's good news if someone's dealing with both.
Yes.
It's going to be a similar approach.
That's it. Exactly.
And so for anyone watching who either has psoriasis diagnosed and they're struggling with it, or if they think that they may have psoriasis from what we've been discussing so far, who would you suggest is the best person to speak to about that?
So initially we would recommend seeing your GP. So if you suspect you may have psoriasis, not had that diagnosis confirmed, then we'd always recommend going to your GP to try and get the diagnosis, accurate diagnosis made as quickly as possible. As psoriasis affects the skin, there's a number of them out there which affect the skin, so it can be difficult if you're trying to Google, for example, to you can easily come to the wrong conclusion if you're looking at the many skin conditions have to be looked into. A GP should be able to recognise psoriasis, and that the sooner you get your diagnosis, the sooner you can start an effective treatment, whether it does turn out to be psoriasis or something else. We would also recommend seeing your GP if you are finding that your psoriasis is flaring, so the symptoms have worsened either suddenly or over a period of time, or if your current treatment is not proving effective. Maybe it's a treatment you've been using for a while and you're not seeing results, then it's probably a good idea to go back and see your GP for a treatment review. So if your psoriasis is more severe, or you have been using different treatments from your GP for a while and you don't feel that your psoriasis is improving, we encourage you to go back and ask your GP about a referral to a dermatologist. So a dermatologist is a skin specialist, so they're trained specifically in recognising and treating, managing conditions which affect the skin. And if you're referred on to a dermatologist, then they have a much wider range of treatment options available that a GP can't offer. I'll touch on these more in a minute, things that include light therapy and also tablet and injection treatments, those systemics and biologics.
Oh, brilliant. I think, yeah, feel free to head straight into kind of the different treatments that are available. Obviously, I know you're not going to be able to explain all of them in one go. It's probably a huge topic in itself, but maybe just the main treatments that are available.
Sure. You're right there, Zoe. There's a lot of individual treatments out there, which is good news for people with psoriasis, because it can frustratingly be a process of trial and error to find something that's effective for you. So the wider range, the better, really. Treatments generally start with topicals, which are applied to the skin treatments, so your creams, your ointment. This is normally what you'll be offered first by your GP. So that can start with moisturizers and emollients. Regardless of the severity of your psoriasis, moisturizing regularly is a really key part of managing your symptoms. And getting into a good routine for that is crucial. It can take time to find a specific emollient that's right for you, but there's a wide range available. Your GP may also offer you creams and ointments which have more active ingredients. So that includes topical steroids, vitamin D, also coal tar. Some of the creams get vitamin D and steroids. Scalp psoriasis has a specific range of treatments, so medicated shampoos and ointments, many of which involve coal tar. If you're finding that you're not getting on well with the topical treatments, or you've tried a number and they're not cutting the mustard, then this is when the referral to the dermatologist will probably take place. So that the next step in the treatment pathway, the first thing a dermatologist would offer would be light treatment. For psoriasis, there are two options here. One is narrowband UVB, which uses UVB spectrum of UV light. And then there is PUVA, which is also known as PUVA. So that uses the UVA part of the light spectrum, plus a chemical called psoralen, which begins with a P, hence the PUVA. UVB is administered by standing in a cabinet with UV light bulbs, and your dermatologist will start you probably at, it can sometimes be a few seconds. This is given in hospital, and it involves regular trips to hospital, normally 2 or 3 times a week for around about 8 to 10 weeks, and the dose of the UVB light is gradually increased over time. The PUVA is similar in the sense that it's a similar kind of, you're going at similar intervals to UVB. However, as I say, it's UVA light rather than UVB. And the psoralen that's added is given either to you orally by a tablet, or sometimes you can bathe in a bath which has a psoralen in it. And then you go into the UVA cabinet afterwards. It's important to point out at this point that the type of light treatment that's given in hospital is not the same as a sunbed in the salon. It uses different spectrums of light, and also your dermatologist will carefully control the exposure to make sure it's right for you and your skin type. So, for example, if you have fairer skin, you wouldn't be exposed as much as if you have a darker skin type. If you don't see improvements with light therapy, or your psoriasis comes back afterwards, the next step would be systemic drugs. So these are mostly taken orally, and a number of those that are available for psoriasis will also be used for other inflammatory conditions. I think AS as well, drugs like methotrexate, for example, might be offered. Cyclosporin is another common one, although there are others available. So yeah, these tend to be taken orally. Methotrexate can be taken by injection. and they're taken regularly. In the case of methotrexate, normally if you can tolerate it and if your monitoring goes okay for a long period of time, cyclosporine tends to be used for a shorter period. And your bloods will be monitored if you're on a systemic medication to check for things like your liver function, any impact on liver function, so the dose can be tailored accordingly, and also if you're experiencing any side effects. So the final step in the treatment pathway is biologic drugs. And these are reserved for the more severe cases of psoriasis, and also for those people who tried the other steps on the treatment pathway and to that point have still found that their psoriasis symptoms continue, or the other treatments have not had that much impact. Normally in the UK, you will need to have tried at least 2 systemic drugs, and for one reason or another, they've not worked out for you, whether that's can't tolerate them or because you've not seen the desired results from them before you get to try a biologic. Biologics are generally taken by injection. There's a range of them available, some of which, again, are also used to treat other inflammatory conditions. Same pathways are involved in psoriasis and other inflammatory conditions. You may have heard of TNF-alpha, for example, TNF-alpha blockers. So there's a number of these biologics available, and unlike the systemic drugs, they don't act on the whole immune system. They act on specific inflammatory pathways, so it's a more targeted approach. And the different biologics, they have different dosing intervals depending on which one you take. But yeah, the good news is that there's a lot more of these available now, and in the last few years there's been a kind of real explosion at this end of the treatment spectrum, so a wider range of treatments available now than ever before.
Absolutely, yeah, it's really exciting to see so many more treatment options coming out. It seems practically, you know, every year we're getting more coming onto the market, and yeah, there's lots of crossover with the medications that help with psoriasis and with Axial SpA as well. So that's something we'd say is, you know, it's worth discussing with your rheumatologist. If you're looking at biologics, quite often the one that they pick will, you know, hopefully help the Axial SpA and the psoriasis at the same time. But it's it was really useful to hear kind of all the steps that you can take for the psoriasis before reaching that point as well. So it was really helpful to hear there's lots of things even over the counter or from the GP that you can do that can help as well.
Definitely.
And we had a really specific question from Nikki before the session, asking about any advice you can give for easing the itching related to pustular psoriasis. She is waiting for a dermatology appointment, but do you have any tips for that or for her?
Yeah, itch is, so for all types of psoriasis really, itch is often an overlooked symptom. Some people actually think that psoriasis doesn't itch, and surely from all the people who talked about the years, a lot of people it's one of the most persistent symptoms. In terms of easing the itch, so when we talk about pustular psoriasis, so given the 2 types, we're talking about palmoplantar pustulosis specifically, the palms and the soles, and moisturising is key. The hands and feet can be really difficult to treat, and so keeping them well moisturised. This may involve overnight, you might apply moisturiser and then wrap your hands or feet in cling film. Again, even during the night, I know this can be difficult because you use your hands and feet all the time, but where possible, that can be helpful. If it's generalised pustular psoriasis, so more widespread on the body, wrapping can be more difficult, really. Good news is there are some tips that kind of apply for all types of psoriasis. So first one, we'd recommend taking warm showers, cooler showers, not hot showers. Hot showers tend to dry the skin out more, which can result in increased likelihood of itching. Secondly, when you get out of the bath or shower, moisturising straight away to again prevent your skin from drying out. You may find it's helpful to wash with an emollient soap substitute rather than soap, so soaps can be more drying for your skin. And also, when you apply your emollients, then it can be helpful to keep them in the fridge because it gives that kind of cooling sensation when it goes onto your skin, and again, that could be helpful in relieving the itch. It could be worth asking your pharmacist about antihistamine as well. This is kind of more anecdotal. Some people with psoriasis found taking antihistamine can help the itch, but not the case for everyone. recommend maybe speaking to your pharmacist before doing that. But yeah, hopefully a few of those tips might be helpful in your case.
Brilliant, thank you for that. There's a few tips that I haven't heard of before. Certainly keeping things in the fridge, that sounds like a really nice soothing thing to do as well, particularly if something is quite sore and itchy. So I'll be stealing that advice. And I think, I mean, we've touched on it a little bit already, sort of talking about kind of, you know, confidence and sort of self-confidence and things, but I think it's probably important to touch on the emotional aspect of psoriasis as well. So can you kind of expand on kind of the emotional impact it can have, but also what the Psoriasis Association can do to help support people with it as well?
Yeah, of course. So absolutely, Zoe, the psoriasis can have an impact for some people on all walks of life. Again, it's different from person to person. So some people can manage their psoriasis and find it has little impact on their life, but for other people it can be severe. It can affect everything from relationships, work, choice of clothes, hobbies, sleep, intimacy, all kinds of things. And this can be as a result of both the physical symptoms. So, for example, you know, if you're itchy, you're uncomfortable, you're in pain, it's going to affect the kind of things you want to wear, the types of things you want to do in your free time. You know, things like going swimming, playing sport might not seem so appealing if you have, you know, visible symptoms of psoriasis, or if your psoriasis is irritated when you get hot and sweaty. So the visible nature of the condition we also find is a barrier for a lot of people. In terms of, well, as much as anything, due to other people's reactions, so people who maybe don't have the awareness of what psoriasis is, and the fact that's a really key point. Psoriasis is not contagious, it can't be passed from person to person. Some people see psoriasis and react. You know, we've heard some you know, heartbreaking stories over the years, people's reactions to people with psoriasis. And I think a lot of the time that can lead people with psoriasis to want to maybe withdraw a little bit, hide away, become socially isolated, which is really unfortunate. There's some great movements now towards body positivity and accepting of, you know, different visible difference, which is great to see. And there's some really good messages being shared on social media about encouraging people to embrace their skin and not let that restrict their lifestyle choices, these kind of things. But it can be really tricky, particularly for people who are newly diagnosed, people who are young. You know, we all know about social media and kind of some of the pressures that come with the things we see on there, ideal body image, this kind of thing. So yeah, when you put all these things together, it's no surprise that there is a higher prevalence of anxiety and depression and social isolation amongst people with psoriasis. Again, not the case for everybody, but it can be. So in terms of what we're trying to do to support with that, first of all, we have our helpline, which is available Monday to Friday by phone, email and WhatsApp. The details, if you'd like them, I think Zoe kindly said you put them, add them afterwards. If you go to our website, www.psoriasis-association.org.uk, scroll down to the bottom, you can find all our details there as well. If you get in touch by a helpline, chat to one of our team. They're always happy to provide information and support regarding psoriasis and all different treatment options, and also just happy to listen if you want to talk, if you want to get things off your chest, if there's not somebody else you feel you can talk to about your psoriasis, then please do get in touch. We also offer peer-to-peer support. We have forums on our website. Again, if you go to our website, you can't miss it. Menu bar at the top, you'll find the forums. So we'd encourage you to sign up. You don't have, anyone can read the forums, so they're available publicly. But if you post on there, obviously you can choose your identity, so it can be something that doesn't reveal who you are. If you want to post anonymously, that's fine. But a lot of people find it really helpful to talk to other people who understand and share similar experiences. Along the same lines, we also have a Facebook group. Easiest way to find us there is just search Psoriasis Association on Facebook. our public page will come up. You'll also see the private group. If you request to join the group, as I say, it is completely private. Only other group members can see what we post, so you can share openly and honestly. Your friends and family won't see what you're posting, get notifications or anything like that. So the group is a real safe space if you want to share experiences confidentially with other people. And we find that peer-to-peer support is really crucial. And some people can give some really good tips in terms of managing the condition day to day and treatment as well. Finally, one other thing we've kind of gone a bit bigger on over the last year or so is sharing people's stories. So we think this is a really important part of our role as a national charity, is to give people the platform to share their experiences with others. And a lot of people over the last year or so have really kindly and bravely come forward and share their experiences with others, and it's pretty much unanimously been a positive experience for all. We always find that these posts have the best engagement on our channels as well, and it's a good way for other people to kind of feel part of the community.
That's amazing. It's fantastic you're providing so much support and in all different ways for people as well, because certainly I think people like to access support in different ways, and particularly like with the helpline, you know, being available not just on the phone, that's really good in terms of, you know, being accessible and helpful for everyone. But yeah, I've followed your pages and seen some of people's stories on there, and it is yeah, I think hearing from people about their own experiences is so helpful. You sort of learn from people, and I think it just, you know, does give that sense of community and togetherness as well. And we find that as well when we share stories from people, and we have blog posts as well, particularly from younger people for As One. I think, yeah, you can learn a lot from each other, and yeah, just provide that support as well. That's great. Thank you for going through all of those.
My pleasure.
So yeah, kind of moving on to some of the questions we were asked before the session, it would be great to get your thoughts on these. And we've mentioned psoriatic arthritis and the fact that inflammatory arthritis can be linked. We had a question from Joanna before the session about whether psoriasis and the location of the psoriasis is linked to arthritis itself. So for example, if you've got arthritis in a joint, will you tend to get the psoriasis over that area? Are you able to answer that?
Yeah, sure. This is a really interesting question, actually. So our understanding is that no, the presence of psoriasis over a specific joint, whether or not you're feeling joint pain in that joint, psoriasis is not an indicator of psoriatic arthritis in a specific joint. So, or other types of arthritis, I should say. But specifically with psoriatic arthritis, we know that despite the fact a lot of people with psoriasis do go on to develop it, then you can have psoriatic arthritis without having any psoriasis present on your skin. Likewise, you can have severe psoriasis and no symptoms of psoriatic arthritis. So yeah, if you do feel pain in a joint, there is psoriasis present, that doesn't necessarily mean that it's more likely to be psoriasis. However, that said, if you do have both psoriasis anywhere on your body and joint pain, we would recommend flagging this up to your GP, because the presence of both could indicate that it might be psoriatic arthritis or another type of arthritis. So it's always best to flag these things up and get them checked out.
Oh, that's really helpful, thank you. And yeah, we'd say similarly for axial SpA as well. If you're getting back pain or joint pain and psoriasis and all the other symptoms that go alongside, definitely speak to your GP, and they may well refer to rheumatology if they think it may well be something inflammatory like that. And another specific question we had from Carol before the session, she's experienced dry skin since she was a child, and she does now have a diagnosis of AS. Would you, I mean, it's difficult to give individual advice, obviously, sort of knowing whether these are linked, but for someone like Carol, what would be kind of the first steps towards getting a diagnosis and a treatment for her psoriasis?
I would recommend going to your GP to discuss this as soon as you can. So, as I alluded to earlier, there's many different conditions out there which affect the skin, and so being able to get that confirmed diagnosis ASAP is crucial. If you do see your GP and you know, about this, then also mention the fact that you have AS. I mean, they should be aware anyway, but I believe it's round about, you correct me if I'm wrong, Zoe, but 9% of people with AS may go on to develop psoriasis. So that's also something else that could help put the jigsaw together. Equally, I recommend take photos of your skin. If you're not sure, before you've had the diagnosis, if you're not sure what condition might be, then take some photos of your skin when the symptoms are particularly flared or pronounced, because it can change, particularly if it is psoriasis. Psoriasis can wax and wane. Sometimes by the time you've got round to the appointment and your GP has a chance to actually look at your skin, symptoms might not be as pronounced. So if you can take a photo to show your GP, particularly in the times we're living in case you're having a telephone or video appointment as well, that can be really helpful. So I recommend doing that too.
Oh, that's great advice, definitely. Yeah, it does often seem like sod's law that, by the time you see someone or talk about it, it's then looking fine, or, you're feeling a lot better. So that's a really good way of getting around that. Wonderful. So I've seen out of the corner of my eye some questions popping up on the chat. I've tried to stay focused on chatting with you, but to everyone watching, thank you so much for joining in, saying hello and asking your questions as well. Please do feel free to keep adding questions, because we'll go through all of those now and make sure we can answer them all. I mean, in the meantime, Dom, while people are adding their questions, I'm having a quick look. Was there anything else about psoriasis or the organisation that you wanted to share with everyone, or has that covered everything?
I think we're mostly there. Just reiterate that if anybody has any questions off the back of this session, or separately in future, then do get in touch with us and say, reach us by email, phone, or WhatsApp, and we're always happy to answer any questions. We're fortunate to have some great links with some real kind of leading experts in psoriasis and psoriatic arthritis too. So we're fortunate to be able to tap into their knowledge for any queries that we're not able to answer as a matter of course with the staff we have in the office. So yeah, please do get in touch.
Oh, that's really helpful, and I'll pop all the specific contact details in the video description afterwards as well. So if anyone's watching and wanting to get in contact, shortly you'll be able to just scroll up and see all the details there. Wonderful. So yeah, thank you to everyone who's watching. Hi to Dale as well, our CEO, is watching. He's finding it very very helpful, and he's really appreciating you chatting with us. So yeah, I'll try and find the first question that we've got that's come through. So Seamus has asked, he gets random skin conditions from time to time. He's also been told he's very pale all the time. He says, I have psoriasis and AS and I'm taking biologics. Any ideas? So I suppose that's quite a broad question. It might not be one that you're able to give much advice for. I'm not sure.
So as regards, so was Dale, sorry, Seamus.
That was Seamus, yeah.
Yeah, suggesting, is it the comments that it's struggling with, or is it kind of the living with?
Possibly. I'm not quite sure. Seamus, if you're still watching, could you maybe clarify in the comments whether that was in terms of managing the psoriasis, whether it was in terms of the comments that you receive related to it? That would be great if you could just clarify with us.
I mean, I'll have a bash in the meantime. So if Seamus, it's kind of people's observations about your skin that you're struggling with or getting you down, then there's no easy answer, because it can be difficult, and unfortunately the one thing we can't legislate for is other people's lack of awareness. I mean, what I can reassure you is that we're working hard to help try and raise awareness of psoriasis. Many other charities are doing the same for other conditions which affect the skin. However, there's also a really positive community of people out there. If you want to check out our social media channels, Facebook, Instagram, Twitter. So lots of people are living with psoriasis who are doing some really innovative things to spread positivity around that, embrace their skin, and support one another. So that might be helpful, particularly if you're, in your day-to-day life, you don't have anybody else in your friends or family that has psoriasis, and it might not be easy to talk about it otherwise. It could be really helpful to talk to other people who understand. In terms of your treatment, so hopefully things are going well on the biologic. I don't know when you might have started this, but if it's only recent, recently, then it can take some time for any treatment to work. And so stick with it, see how you go. But if you don't see the results that you're hoping for, then do go back and discuss this with your dermatologist. Because as I mentioned earlier, we're lucky these days that there are a range of treatments available, and when you get to biologics as well, it's not just one, there's a range that are available. So if you stuck with it and found you haven't got the result you hoped for, then don't be afraid to flag that up to your dermatologist, because there are other options that you can try.
That's really helpful. Yeah, I think you've definitely covered both bases there, so that's great. And yeah, I would definitely say I think social media can be so powerful like that, can't it? You know, although there are sort of the worries with it, it can have a negative effect on us. It can also, if you really kind of curate who you're following and interacting with, it can have a really positive effect as well.
Absolutely.
So the next question we've had in is from Amy. Hi Amy, thank you for asking this. So Amy has psoriatic psoriasis and is trying to decide if she should go on to medication the specialist recommended. She said, will the medication actually make the swelling go down? I think that might be a specialist question.
Yeah, unfortunately, I can't give you any guarantees, and also the decision about whether to start any specific medication or not is very personal, depending on your own situation and the things, you know, your own treatment preferences, and also the things that are affecting your day-to-day life while living with the symptoms of psoriatic arthritis, you know, swelling, stiff joint pain, potentially. So what we would say is that if you are having any concerns, we'd recommend speaking to your specialist. It's important that they're aware of any concerns you do have, because they may have some answers for you. They, you know, see a lot of people in similar positions, can share a benefit of their experience with you. So don't be afraid to have that conversation. I think that's really key. Medication, as I say, there's no guarantees. It can work differently for different people. Some people can hit on the first medication they try, can have real positive effects for them. For others, it can take you know, more trial and error approach to get to the right one, and equally with potential side effects. When it comes to side effects from medication as well, I'd recommend bearing in mind that if you look on forums and things, there can be a lot of experiences that talk about side effects. Different people experience them to different extents, and because a side effect is listed in patient information leaflet doesn't mean you'll necessarily experience it yourself. So, but again, if the side effects are something that are worrying you, then it's important to discuss that.
Thank you for that. Yeah, and that's something we see a lot of as well, in terms of, you know, if someone's experiencing side effects or finding something difficult, obviously they're going to post about it to look for advice. So you won't necessarily then get the balance of the people who don't necessarily get the side effects. So exactly. Yeah, definitely worth having that conversation with the specialist. And in terms of some more specific advice, so Emma's waiting for an appointment, but she has dry skin around her eyes, and she wondered if makeup can still be used. Yeah,
so when it comes to makeup or any cosmetics, so if you have psoriasis or any other condition which affects the skin, we recommend doing a patch test first, so just to make sure that the makeup isn't going to irritate it. So if that's okay, then by all means feel free to use makeup as you normally would. But just keep an eye on your skin, see how it's reacting. You know, if your skin isn't reacting so well to it, perhaps, you know, maybe leave the makeup for now, or use that. But yeah, there's no reason why, if you have psoriasis, you can't use makeup. See how your skin reacts.
Oh, brilliant, thank you. And we've got a question from Jane, who has psoriatic arthritis, and she said that she's getting psoriasis on her nails, and they're becoming very brittle and weak. She's tried lots of over-the-counter hand and nail products, listed like vitamin E oil, B supplements, and aloe vera cream, and sort of the cotton gloves at night and things. Do you have any other suggestions that might be helpful for that? And we may have touched on this a little bit earlier.
Yeah. So there's a couple of things that you could do. I mean, for one, we'd suggest going back, if it's something that's, you know, affecting your day-to-day life and your quality of life, then have a chat with your GP. There may be something that they can advise. Some of the topical treatments that are used for psoriasis elsewhere in the world, including more active treatments, steroid creams, for example, they can be used along the nail. So they work on the psoriasis that's affecting the nails. So that might be worth speaking to your GP about. There are also, there's a tape available. I think it's pronounced Helan tape. That might be something to talk to the GP about. So it's a medical tape that you can use to wrap the nails, and that can help with the symptoms of nail psoriasis. So yeah, I'd recommend asking your GP about those things. Nails can be really persistent and stubborn and difficult to treat, so I can't again offer any guarantees, I'm afraid. But keeping the nail short in the meantime can be helpful, because the longer the nail is, the more likely it is to catch. And as I explained earlier, that can be really, really painful when you have nail psoriasis. So yeah, keeping the nail short. And we do actually have some further nail care tips on our website. So if you go to our website and type nail psoriasis into the search bar, then we have some nail care tips on the nail psoriasis page. So have a look at those too. It might be able to be helpful for you.
Oh, perfect. Thank you. And Jane, I'm happy to pop the link in reply to your comments after the session as well, so you can read more about it there. Now I have a slightly more unusual question, which it might be a bit of a curveball. Michelle's asking, she's a nurse with AS and psoriatic arthritis, and she said she has persistent rashes on her face, which she thinks may be pustular psoriasis, but it coincided with starting to wear surgical masks. She said, is this just a coincidence? I imagine it will be something that needs to be seen, but it'd be great to get your input.
Yeah, of course. You're right, Zoe. I think it would need to be, best thing is to visit your GP, or if you're already under the care of a dermatologist, to get that checked. If it's something, if you visit, I think you said the lady has psoriatic arthritis already, so if she's under the care of a rheumatologist, it might be worth mentioning that as well. It's possible some instances your dermatologist might be able to arrange a referral to a dermatologist. Pustular psoriasis specifically is rare on the face. However, you can get psoriasis on the face. That's certainly a possibility. And we do know in people with psoriasis that mask wearing can cause irritation, which flares that up. So, it is possible. But yeah, it's also, we know that there's, with the increased mask wearing that we'll have to do, particularly if you're a nurse, I imagine you spend a long time in the masks, day in and out, then there could be a range of skin irritations that it could be. I believe the British Association of Dermatologists has some information on this, so it might be worth taking a look at their website, or if not, then getting in touch with them. I'm sure I've seen they've put some information resources out about irritation around masks.
Oh, excellent. I'll have a look at those and can always share them in the comments as well. Thank you. It's great to see Nikki's watching live, and we answered her question earlier. So hi, Nikki. So she was asking about PPP, and she did feel it was kind of at the blistering stage that the itching she was getting was bad. But she said she definitely relates to the burning description that you gave. So yeah, thanks for joining, Nikki, and hopefully those tips were helpful as well. So do let us know how you get on with those. And just, we've got a couple more questions coming in. We've got lots of people watching live. Steve's asking, so he's had psoriasis from his teenage years, well before signs of AS, and the psoriasis has got worse in the last few years, which kind of built up to the diagnosis last year. He said, is there a direct link between the psoriasis activity, or the amounts of psoriasis, and the activity of AS, or potential fusion with AS? That might be a bit of a tricky question to answer. Yeah,
it is tricky. I would say along the same lines of what I mentioned about psoriatic arthritis, there isn't necessarily a link between the activity or the how widespread your psoriasis is and the activity of any underlying joint symptoms, whether that's psoriatic arthritis, AS, or another type of arthritis. So I mean, if you notice that, you know, your psoriasis has flared up and your joints are also more painful, then we certainly recommend flagging this up to dermatologist, or if you're already under the care of a rheumatologist, your rheumatologist too. But there's not necessarily a correlation between the two. It might just be coincidence. But either way, you know, if your skin or your joints are flared up, then that's something that we recommend talking to dermatologist or rheumatologist. You know, it's important to get that managed as soon as possible.
Absolutely. And I think something along the same lines, probably, Gianne's just commented, she has a fungal nail problem, but only on her right foot. She's asking if it could be connected to her psoriasis and her AS. I imagine that might, again, be another thing that the GP would need to have a look at and decide, really.
Yeah, I'd recommend speaking to your GP about that. In the case of nail psoriasis, sometimes that can be resemble similar symptoms to a fungal nail infection. So it's possible, we have known that people who have nail psoriasis have been misdiagnosed as fungal nail infection, or vice versa. However, obviously, you know, it's best to go and see your GP and get the specifics checked out.
Absolutely. And some more specific advice, possibly. Steve's having a hip replacement surgery in 12 days' time, and he said he needs to get clear, at least in that area. But he said the Dover vet isn't clearing it. I'm not sure what that is, but do you know if there's anything else he could do?
So Dover vet is a topical steroid. So that would have been prescribed by a GP or dermatologist, I'm assuming. So I know 12 days, it will come around quite quick. If it's possible for you to visit your GP, get a GP appointment in that time, we'd recommend doing so, because that's the quickest path to be able to review treatment. And it's possible they'll give you something else to try, which might have better results for you. We recommend that you moisturize well. I'm sure, you know, that's probably not anything new that, you know, not been advised to do already, but even if you're using an active treatment, so a topical steroid, for example, it's important to moisturize as well, because that can help the active treatment work more effectively. So moisturize well and regularly, and yeah, if you can get in to see your GP before your operation, then that hopefully will be helpful too. But either way, I wish you all the best with the procedure too.
Yeah, absolutely. Good luck, Steve. I hope it helps things lots. And we're getting a few comments just coming in from Raj, from Lizzie, saying thank you. It's been really helpful today. So anyone else watching, if there's any sort of last minute questions, please do pop them in. But I think we've covered everything. Just go through. We've got two questions actually on a similar thing. So Katie's cousin has psoriasis that causes her hair to thin, and similarly, yeah, I think she's asking it whether there's any link with sort of hair thinning or alopecia, or if it's just a coincidence. In
the case of scalp psoriasis, there can be more severe cases of scalp psoriasis. Sometimes the hair can come out, particularly, for example, when you're trying to treat the plaques on the scalp. If you're combing the plaques out, sometimes the hair can come out with it. Normally, this is temporary, so the hair will grow back as normal. If this is something you've been experiencing for quite some time, we'd recommend bringing this up to your GP, or if you've got a review coming up with your dermatologist, recommend you bring that up anyway, because it's an important part, you know, of your quality of life. But hopefully it will be temporary. If the symptoms have been persistent, then speak to your GP or dermatologist. It could be the signs of, you know, potentially of alopecia. If that is the case, then they'll be able to advise. But there's a great charity out there, Alopecia UK, who can also provide support. As I say, that's, you know, it's likely that it's probably just a temporary thing. We hope that's okay. We manage with help from your GP.
Oh, that's really helpful. Thank you. And we've got one last question that's come through from Seamus. So he's noticed in the last couple of years ago, since being diagnosed, that his shoe size has got smaller, like his toes have recoiled. So I don't know if that means his toes have bent. Do you know if that's sort of any link to psoriatic arthritis or psoriasis or anything?
That's a really interesting question. I'm not sure, to be completely honest. I would suspect with this, it's more like it could potentially be related to psoriatic arthritis, depending on you know, the impact that's having on your joints, Seamus. So it's possible that could be linked. So again, that's another thing I recommend bringing up to your GP or rheumatologist if you're already under the care of one. But I can't give you a firm answer, I'm afraid. But yeah, unlikely psoriasis, possibly more.
Absolutely, yeah, and I'd agree in terms of AS. Quite often people can have things wrong, sort of plantar fasciitis and things like that, which, you know, may well be something like that. So yeah, definitely worth bringing up with the specialist. Oh, and Katie's clarified as well. Just checking if alopecia is linked to AS or psoriasis. So yeah, as far as we're aware, there's not a certain link with alopecia.
No, we're not aware of any particular link between psoriasis and alopecia. And Zoe, you're probably better giving an answer than me on AS, but I'm not aware of any particular link between AS and alopecia.
No, I'm not either. But yeah, certainly the organisation you mentioned as well would be good to check with them because they may know the two.
Definitely. Yeah.
Brilliant. And Steve's commented, thank you for the advice. And Katie as well. Thanks very much for that. And Steve said he's never seen a dermatologist despite having the psoriasis all over his body. So I think, yeah, that'll be a really good next step to get things sorted.
Yeah.
Brilliant. So we've covered all the questions. Dom, I don't know if there's anything we haven't covered that you wanted to mention. I think that's been, you know, really thorough, which I really appreciate. Thank you.
Yeah, just thank you both to you, Zoe and NASS, for giving me the opportunity to come on, and for everyone who's watched and asked questions. It's been a real privilege. I'm sorry I've waffled a bit, but I hope there's been some good information in there. And yeah, thank you. I really enjoyed it, actually.
Brilliant. Oh, I'm glad to hear that. And if you say that, then we'll probably have you on for another one. So watch out. No, it's been fantastic. No waffling. It's been really good information. I mean, it's such a huge topic of, you know, topic and area we could probably talk for hours. So it's been really good to get all the key stuff. And from the comments coming in, everyone's found it really helpful. So thank you very much. And for everyone watching, if you've come on partway through, the video will stay on the page afterwards and we'll pop it on our website on My AS My Life as well, so you can come back and watch anytime. Similarly, I'll make sure all the information about the Psoriasis Association is in the video description as well, so you can get in contact with them anytime and get more information and support as well. So before we finish up, I'll just let everyone know what our next session will be. So next week, Wednesday the 10th of March, we're having an evening session, 6:30 till 7:30, with Jamie and Jeff from Yoga for AS. So they're running a yoga practice session for around 45 minutes and also doing a quick Q&A at the end to answer all your yoga related questions. So we'll be advertising that from Saturday onwards, so do come along and get involved. Similarly, that session will stay on the page afterwards. So if you want to just watch the session to begin with and then have a go at the practice afterwards in your own time, then you're welcome to do that as well. So yeah, we're having loads of comments coming in thanking for the advice and for your time today. So thanks again, Dom. And yeah, and thanks to the Psoriasis Association for coming on and chatting with us. So we'll finish up there, but I'll keep an eye on the comments coming through in the next few days. And make sure that we answer any of those questions as well.
Sure.
Thanks, Dom. Take care, and take care, everyone watching.
Thanks.
Bye.
Thanks.